Hello and welcome to The Wise Approach, an NHS Wellness Coaching podcast. Here we'll share real stories and day-to-day steps to help you improve your long-term health struggles. I'm Dr. M, a clinical psychologist with the Wellness Improvement Service, or WISE for short.
And I'm Dr. Lisa, a GP and specialist in lifestyle medicine, and I'm the medical lead for WISE.
Thank you so much for joining us today. We're really happy to have you here. At WISE, we believe that everyone has the power to improve their own health and well-being. Just by listening to this podcast or watching on YouTube, you've already taken a step towards maximising your quality of life. Because we'll be sharing lots of tips throughout this podcast series on things like improving sleep, reducing chronic pain, coping with anxiety, boosting your mood, and getting the most from your food. Generally, how to live a healthier, happier life and the small steps that you can take to get there.
Absolutely, Em. This podcast is born from our first-hand experiences at the WISE service, where our wellness coaches utilise a lifestyle medicine approach to assist patients. So lifestyle medicine, for those unfamiliar, is a scientifically backed field focusing on enhancing health and well-being through the 6 pillars, which are sleep, mental well-being, exercise, nutrition, social connection, and minimising harmful substances. Tune in to discover what strategies have proven effective for others and explore how these steps could benefit you too. Connect with us and stay updated via social media. So we are on X and our handle there is @YCTM. And if you do have any questions or feedback, then please direct message us on there. But let's get on with today's show.
Today we're talking about lifestyle medicine. So Lisa, the WISE service is based around the principles of lifestyle medicine, right? But can you start by telling us what is lifestyle medicine and why are you so passionate about it?
So our WISE service is led by health coaches that practice lifestyle medicine or help coach people in the principles of lifestyle medicine. So lifestyle medicine is an evidence-based field of medicine where we use lifestyle changes in order to improve or reverse many long-term health conditions. So we know that giving out pills has its place in medicine, of course. So it's not anti-medicine, but it should just be one part of the puzzle. So medication doesn't always get to the root of why people became unwell in the first place. But with using lifestyle medicine, it helps us to work out why someone became unwell in the first place and how we can get them back on track. Because the way that people live their lives almost always has an impact on their condition. So whether or not that's a physical condition or a mental health condition. So it might not be always the definite cause. So obviously we know there are a lot of genetic things that aren't related to lifestyle, but often just using lifestyle can actually improve the experience of living with that condition. So it can still have a positive impact. So no matter what the condition is, making some simple lifestyle changes can have a dramatically positive effect and certainly make you feel like you're more in control of your own health and well-being, and that you're not just handing all the control over to your healthcare providers. So lifestyle medicine is based on 6 pillars, and all 6 pillars are equally important. So not one is more important than the other, and they're all interconnected and they all have an effect on each other. So the 6 pillars are sleep, social connection, so your relationships and who you are in your community, your mental well-being, minimizing harmful substances, so that could be reducing your alcohol or smoking or drug use, or it could be trying to improve the quality of air that you're exposed to. And then the others are physical movement, so any type of exercise, and of course healthy eating, so eating the right foods to support our health and well-being.
Wow, it sounds like exciting stuff. There were a couple of things you said there that got me really excited. And one is that it could mean that these long-term health conditions are even reversible, so that they might not just get better, but they might be totally reversible with these lifestyle changes. And I think that's a really exciting prospect potentially.
Yeah, so actually, as a GP, 80% of what I see can be related to lifestyle, and lifestyle medicine can help reverse that. So if you think of all the conditions, and lots of us complain that we can't get into our GP. Well, actually 80% of what the GP does is related to how we live our modern lives. So imagine if we all transformed our lives as communities, then that would certainly have a knock-on effect on the healthcare service and our ability to access it when we really need it for things that aren't necessarily related to lifestyle. But yeah, it certainly has an impact on the way you feel and your long-term health and your ability to live a longer, happier, healthier life.
Yeah, so even for things that aren't reversible, the other word you said that got me really excited was control, because I feel like there is a lot of waiting in healthcare, and that perhaps people, I have definitely felt like I'm at the whim of healthcare professionals. I'm waiting for them to refer me to a specialist, or I'm waiting for test results back, or I'm waiting for the phone lines to open at the GP. I'm waiting for an appointment. There's so much waiting in healthcare, and it sounds like the approach that you're talking about is the opposite of waiting. It's about the actions that you can take, things that you can control, that you can do right now.
Yeah, there's nothing worse than just waiting, is there, and just feeling like you're in limbo. And often people, when they're waiting, they're actually thinking they're getting worse. So it's not just waiting. You're stood still. A lot of people feel like they're going backwards, because if they saw their specialist sooner, perhaps they would get better sooner. And that's the worry really with waiting lists that are getting longer, is that people are getting worse and that they're developing other health problems while their original problem got worse. So certainly with lifestyle medicine, it does give you that feeling like you can do something, and you can do something small every day that stops you from going backwards, and either keeps things under control or in fact improves things. And we have heard a lot of stories of patients who've worked with us in our service who actually get so much better that they don't actually need to see a specialist anymore. They don't need to have more medications. They've managed to reverse things and improve things through their own actions, which is even more exciting really. And these are some of the positive stories we want to share, so that other people can get the same results.
I'm really excited to hear some of the patient stories from people who've really taken the lifestyle medicine and they've run with it and really changed their lives. And we'll be hearing through that from them all the way through this podcast.
Yeah, exactly. Because we've been really fortunate that lots of our patients do want to share. And I think that's one thing that you often get with lifestyle medicine, actually, is that when it works, people can't help but share. We're all creatures of that, aren't we? We're all creatures of a positive story. So if I'm going to do something that really improves my energy levels, or makes me sleep better, or makes me feel better, I'm going to share that with my friends or my family. You want everyone else to feel good around you as well, don't you? And you want your kids to feel better, for example. So anything that works for you in a positive way, you're going to be wanting to share that. So it's definitely the opposite of medications in that way. So if I prescribe a cholesterol tablet for someone because their cholesterol is high, for example, that only works for them. It doesn't work for their children. It doesn't work for their friend. It doesn't work for their neighbor. It just works for them. But if I work with them through a lifestyle medicine approach and change their diet, and then they can see a dramatic change in their cholesterol numbers, then they're going to share that information with other people. And they might want to implement those changes themselves and see a knock-on effect. So it's kind of like snowball medicine in a way.
Mm-hmm. Yeah, it sounds like this new thing that you want to be messaging everybody about on social media. And oh my goodness, have you heard of this thing? Like sharing a great new TV program you've seen, or a book, or a recipe, and it was so good. You just want to tell everyone about it. And that's the sense, as you talk about it, that's the sense I get about lifestyle medicine, that it's something that impacts on people in, such a powerful way that people, they can't help but share it.
Yeah, it's like that common meme, isn't it? Like, how do you know your friend is a vegan? Oh, because they've told you before you even
Yeah.
asked. And often it's because they want to tell you because they feel so much better when they've changed their diet. And that's similar to this. It's like any health intervention. People love to share when they feel better about something, like all the people who do cold water therapy or cold water dipping now, they love talking about that, and how it gives them such a high when they come out of the cold water. So this stuff works in the similar way, where people get that buzz when they go, I can't believe I've managed to change this all by myself, from the work I've put in, the commitment I've put in to myself, and I've got this result, and I really want to share it with other people. So yeah, hopefully through this podcast we can share some of the stories that patients who've already gone through this process, some of the results that they've got.
Yeah, exciting stuff. And I wonder, as you talk about lifestyle medicine, I get this kind of image of an iceberg, and that right at the top of the iceberg, we've got the kind of chronic pain specialist, or the specialist in that particular long-term health struggle, or we've got this very particular medication or this advanced surgery, and that's the kind of tip of the iceberg. But it sounds like there's this whole other hidden stuff that we're not really talking about. I wonder if people have forgotten about the foundations of health, those ingredients that you talked about that make up good health, like good sleep, connecting with people, moving your body, diet. That's not kind of what we hear about when we hear about health. We hear about those more kind of specialist interventions and medical interventions. Do you think we've forgotten about the foundations of health?
Yeah, definitely. It's, this is the old art of medicine. This is what people always used to do. And, you used to be advised by your grandparents and great grandparents to, eat better, to improve your health, etc. But we've kind of lost that art, where we've become more dependent on medicines or surgical interventions, which basically then means that it's very difficult for people who really need that specialist medicine or specialist surgery to get it, when everyone is booked in for the same. So it's sort of, the problem is instead of it being specialist for some, it's specialist for everyone, and then that results in specialist for no one. Well, no one for at least a year or two while you're waiting, and then while you're waiting, the risk is that you're getting worse. But actually, that whole iceberg is all the lifestyle tools that we can put in, and even if your condition absolutely needs that specialist intervention, having that foundation underneath is going to make that specialist intervention much more likely to work. So you're likely to get better outcomes. So, for example, people who need to have surgery, so say if someone needs to have a knee replacement because their knee is so painful and it's so arthritic, if we can get them to implement these lifestyle pillars, so if they can sleep better, if they can improve their well-being, if they can improve their relationships with their family and their friends, and stay socially connected, if they can exercise more, if they can eat better, if they can reduce the amount they're smoking, drinking, or taking various drugs, then that actually means that when they have the surgery, they'll have a better outcome. They'll be able to leave hospital much quicker with a better result, and less likely to get some of the complications that everyone has to sign the risk waiver for, the consent form. So even if you need to have that special intervention, this stuff can still help, and still help you in the meantime, to make sure that by the time you're seen, you're not in a much worse state with worse mental well-being. Because imagine living with a really painful knee for years on end, waiting to have it replaced. It's going to have a knock-on effect, isn't it, on how you feel and what you can actually do, which is a terrible state then, because you are feeling then that you're just waiting or going backwards in life, or your life is on hold. And we don't want people to feel like that. None of us in the NHS want people to suffer. That's not why you go into the NHS to work. You want to help people feel better, and sometimes that can be really tough for our own personal morale and our own well-being, when there is so much suffering because of the way the system is. But actually, by helping people to implement this, it can be a real boost for the patient and all their friends when they share it, but also for us as staff, because we feel like we're really getting to know people and really making a difference to their day-to-day life.
Yeah. It sounds like in some ways we've got too clever, and too specialist. I think it was Einstein that said the simplest solution is usually the correct one. So if you
Yeah.
come up with a solution that looks really complicated, it's probably wrong. And that's
Yeah.
kind of how we got to E equals MC squared, which is like so much shorter than the chalkboards full of formulas that he was writing out. And he was like, this is so complicated, it's almost definitely wrong. And
Yeah.
I love that principle of, coming back to things that are really simple. But I guess one of the things that we'll be talking about in this podcast is that life is complex and people
Yeah.
are complex and people have really busy lives, and it can be really overwhelming, especially if you feel like you're struggling with potentially several like long-term physical and mental health struggles. Where do you start? What's the first step to take? How do you take these simple principles and apply them to real life? How does it apply to you? So it sounds like that combination of a kind of simple formula, but helping people to apply that to complex lives.
Yeah, and that's where the magic is. So, a lot of people will think, oh well, lifestyle medicine or how you live, obviously everyone knows that. Everyone knows you should eat better, everyone knows you should exercise better,
Right.
everyone knows you should
Don't have
not smoke.
a McDonald's breakfast because that's
Yeah.
bad for you.
But
Everybody knows that.
yeah, but actually, one, not everyone knows that. So
Mm,
certainly from working where we work, not everyone knows that. So not everyone knows what's healthy and what isn't.
yeah.
And two, even if you do know, it can still feel exceptionally overwhelming. So particularly when it comes to diet, for example, there's so much information out there, so much conflicting stuff. And if you're really sick and you want to use diet and nutrition to help you get better, it can feel really overwhelming then when you think, what am I supposed to eat and what is going to be harmful for me to eat? I've been in that situation personally. So when my daughter was diagnosed with her condition and I started learning all about lifestyle medicine coming up to 10 years ago now, when I looked at all of these principles, I felt it was really overwhelming. And I remember starting to get really overwhelmed and anxious and panicky in the supermarket thinking, oh my gosh, what is going to be safe here? What is going to be harmful? Everything I'm reading is, that's going to be harmful. That's going to be harmful. Should I go organic? Is this pesticide going to be a problem? How am I going to have all of this nutrition in 24 hours? Whilst exercising, whilst sleeping, whilst reducing my stress levels, of not kind of trying to juggle all of these steps. So it's although people think, oh, it is really simple. It's not easy in
Mm,
practice, and it's not easy when you have a lot of barriers to living a healthy lifestyle. Most of our towns and communities aren't built to support people's well-being. We have really modern town planning, which can make convenient foods really convenient, and you actually have to bypass your junk food stores in order to get your healthy foods. Well, that's not easy if your life is really, really busy or you have transport difficulties, etc. So our service really tries to look at what those hurdles are and help people get over those hurdles so that it's actually more simple to put it into practice, into day-to-day life, because it is all about you and how you live your life and what's going to make a difference to the way you live your life.
yeah, great. And that's exactly the phrase that I was looking for. Sums it up perfectly. Just because it's simple doesn't mean it's easy. And that's why the wellness coaches within Y support people every step of the way to figure out how to apply lifestyle medicine to their life, right? And hopefully in this podcast, how we'll be supporting people every step of the way to think about that as well. I wonder, are there some people that are too unwell for lifestyle medicine? Their condition or their struggle is too complex for this to be of benefit.
So yeah, that's another common question. So not really. Lifestyle medicine suits everyone of all ages. That's the the benefit of it, really. And it doesn't have side effects other than making you feel better. Certainly there are some advanced conditions or certain conditions that aren't caused by lifestyle factors in the first place, that lifestyle medicine is not going to be able to reverse, and then you do need to have more specialist intervention. However, it can still improve a lot of your experience of that condition, and it can minimize the symptoms or how you experience the condition, and it can also help you control it a lot better and make you feel a lot better about it. So it can stop you from developing the knock-on effects of living with a complex condition that is really difficult to manage. You know, if you think of some autoimmune conditions or genetic conditions or rarer conditions, often feeling the isolation of living with such a condition can then have a knock-on effect on your mental well-being. It can have an effect on your relationships or your ability to work or your ability to socialize. So we can use lifestyle medicine to adjust the other factors in people's lives, which will then mean, right, okay, if I live with this condition, but now we've used lifestyle medicine to change my social relationships. So now actually I'm not defined by this condition anymore. I have a whole me that lives my life, and this is in the background. So this is not overshadowing everything. So we can use lifestyle medicine in an adjusted way that way, I'd say.
Yeah, it sounds. And what you were saying there really struck me as well, that it depends on the person. So it's putting you at the center and figuring out, okay, so you've got this cocktail of long-term health struggles. You live in this social setting. You have these specific dietary requirements. And it doesn't sound like a one size fits all. It's really thinking about, how can I improve my sleep? How can I improve my health, my pain, my physical activity? So applying these principles in a way that's just focused on my life, because everyone's different, right?
Yeah, everyone's different and everyone has different priorities. So, you know, if I will use lifestyle medicine with someone and say, right, we need to sort out your sleep, for example, because you regenerate and you heal in your sleep. So sleep is the most important thing. Well, if to the person, they're not that bothered about their sleep, because actually what's more pressing for them is the fact that they can't look after their grandkids, or they're struggling with work, or they're really worried about their finances. Well, I'm never going to be able to improve their sleep if I don't understand the fact that all of those factors are keeping them awake at night, and they don't think sleep is the problem. They think other things are the problem. So we always have to get to the root of, right, what's the most important thing at the moment, and where do you want to get to, and how can we actually make an improvement or reduce, you know, what's bothering you the most, and then we work from there. So lifestyle medicine is always a partnership with patients. You don't just I don't just prescribe whatever I want. I work with the patient to develop more of that kind of partnership approach, rather than me leading them as their doctor.
Yeah, and you need to understand what an improved quality of life means for that person. What does it look like? Otherwise, you're not kind of aiming for the same thing, I guess. So, yeah, I think it would be.
The difficulty is, a lot of my patients don't know what good quality of life would look like. They don't know what well would look like. So that's the difficulty where we work, is that long-term health conditions is almost the norm. So we both work in quite a deprived area of South Wales, and there's lots of health conditions there, lots of long-term health conditions. And the sad thing is that a lot of people expect to get unwell. So they expect, and some of my patients even expect to get unwell in their 30s. So that's kind of how far off we are of where we should be getting patients to think wellness is and what well is like. Because a lot of my patients think, well, I'm in my 30s now, I don't expect to be able to jump out of bed. So I spend a lot of time going, well, actually, in your 30s, you should be jumping out of bed. You should be jumping into bed and out of bed. You should feel great all the time. You know, you're not. You know, you shouldn't be thinking, well, I expect to start getting unwell now because that's my normal. That's what I see all around me. So we certainly have a lot of challenging what people's beliefs are around what well is and how well someone could be. So we need to kind of inspire that change and get people to really imagine what life could be like and what well could be like, and take inspiration from parts of the world where people live well until they're at least 100. They're still, part of their society. They still do all the things they want to do. They still work, a lot of them. They still feel valued, and they're, living their lives at 100. They're not sick and old at 100. And that's where I'd like to take Wales, really, that we all kind of think, yeah, let's live well into our hundreds, not just use medications to extend our life, but be ill the whole time.
Yeah. And, we're not on our own with that, because we have got these evangelists now, people that are so passionate about the WISE program, passionate about improving their quality of life, people who've really experienced that change and have been surprised by that. And, they've got a better quality of life than they ever have. And now they're spreading the word about that. So I think that's perfect timing, Lisa, to hear from one of the WISE participants now and just see what his experience was. So here is Stuart.
Why did you join the Wellness Improvement Service, WISE?
I approached my specialist about having more pain medication, because the pain medication I was on, it just wasn't seeming to help. The longer I was going, it seemed the less the pain medication was helping. So I asked to be put in touch with the pain clinic in Royal Glamorgan. They're the people who prescribed the pain medication I was on in the first place. And under their advice, they asked if I could do this programme to see if that would help before my pain meds were actually increased. So I was a bit sceptical about doing it. I thought I could do in a programme lessen the pain, then I thought only the drug meds could help with the pain. But signed up, went along with it, and really glad I did.
How has WISE helped you on a personal level?
So me being able to cope with the pain and my perceived level of pain, I think, has gone down. So not looking really to have more pain meds to help me and coping it more. And there's other benefits as well that came along with the programme. Better mental well-being, being able to interact with my family more. They give you a toolbox of being able to cope, and that really helped. That did. Helped with sleep, helped with spiraling weight, depression, all seemed to get better following this programme.
What have you learnt with WISE that you can take forward to self-manage your health?
That my life really isn't about my condition, that my pain isn't the be-on and end-all of everything. So it's given me the techniques and the willpower to be able to put pain in its place, so I can have more of a meaningful relationship with my wife, with my children, with the rest of the family and friends, which, to be honest, I was getting more isolated from. So this has helped. Bit of an eye-opener sometimes, but then good that they give the techniques and the way to sort that stuff out.
Would you recommend WISE to your friends or family?
Yeah, totally recommend it. It's a real game changer for me. I really see the benefits in my life. And if it can help somebody else, yeah, go for it, try it. At the end of the day, you've got nothing to lose. If you only gain one little bit from it, it's totally worth doing. It's really changed my outlook, and that helped a lot with the pain. So much so, I'm not looking to have more pain medication at the moment. It might come a part of my life where I do need to, but I'd probably return to this program before I go down that pathway again.
Okay, so we've heard Stuart's story there. So Stuart, as he said, was very skeptical coming into our service. He lived with chronic pain and he just wanted to get more pain medications or increase his doses. And Stuart isn't alone there. That's a lot of patients who live with long-term pain conditions, even if they're on multiple medications and they don't feel they're really working, or they're getting a lot of side effects from those medications, they still feel the only option for improving pain is more higher doses or multiple medications. So we've had a lot of patients been referred to us to see if actually taking a different approach can improve things. And as Stuart said there, it has improved his pain. He's not looking for any more pain relief for the time being, and he's using the tools that the coaches have supported him to implement in his day-to-day life. And like he said, he thinks everyone should give it a go, because what have you got to lose?
Yeah, what have you got to lose? Absolutely. I thought that was just so inspiring, and really inspiring as well that, Stuart's pain hasn't completely gone away. He still experiences some pain, but he said, I've put pain in its place. I don't feel like it's taken over my life anymore. There's so much more that he can do. And I think that's really exciting. So what have you got to lose?
Yeah, because lots of people do feel that they just get defined by their health conditions. And that must be awful when you think, all I am is this health challenge now. And like Stuart said there about the fact that hasn't just improved his pain, but actually improved his relationships with his family, with his wife. He feels like he's living again. And that is, that's the magic, really. You don't really get that when you're prescribing medicines. So it's such a rewarding way to help people, because they really do get huge life transformations. So with WISE, we're really fortunate that a lot of patients have been willing to share their stories, and we want to use this podcast as another sort of platform to be able to share that, because if that helps inspire someone who's been suffering in the same way, then that's brilliant, isn't it? That's all we want. We want people to think there is another way, there is some hope out there. You don't have to just suffer by yourself, that actually there's lots of people out there who want to support you to feel better.
Yeah, absolutely brilliant. And thank you to Stuart for sharing. And you were talking about prescriptions there, Lisa. And we've reached that part of our podcast where the doctors have their WISE prescription pads out. And we're going to prescribe a WISE strategy every episode, something that helps you to take one step towards your health, towards better health, or improving your quality of life. And do get in touch with us and let us know how you get on with this.
Yeah. So in lifestyle medicine, we try and make it very similar to what people would know of Western medicine. So obviously, if someone comes to see me as a GP, often they expect to walk out of my room with a little green prescription. So in lifestyle medicine, we've kind of adopted the same, but we create a prescription with the patient. So it's not just me saying, right, here's what you need to go and do for the next week. We come up with a shared plan that the patient is happy to give a go to, and we try and make it very similar to, say, if I was going to prescribe an antibiotic to someone. So on that prescription, I would say what I'm prescribing, how to take it, and when to take it. And the same with lifestyle medicine. So what it is, how you're going to do it, and when you're going to do it. So that's how we kind of break it down. But with each of these podcast episodes, we want to try and share a strategy that one of our health coaches has successfully implemented with their patients, so we can share that with you guys if you're not part of our service already. So Emma, why don't you start off by sharing what we recommend starting with this week? And yeah, as Emma said before, we'd love to hear how this has actually impacted what you thought or how you felt this week.
Yeah, so you can find how to get in touch with us in the show notes, and please get in touch. We'd love to hear from you. And we were reflecting on the main change that people see when they've been through the WISE program, and people tell us that they feel like they've got more energy, and we thought, well, that's great, but what would you want to spend that energy on? Like, why does that matter? And we think this is something that is really overlooked.
Yeah.
So that's our challenge to you this week, is to get a pen and paper out or have a conversation with a friend or a loved one and really think about, if your quality of life was the best it can be, your health was the best it can be, you're sleeping really well, you're eating really well, your pain is gone, your quality of life is better than ever, and you've got all of this energy, what would you spend it on? We want people to imagine what life could be like for them. What do you want to do if you had this infinite pot of energy? And get in touch with us and let us know what that would mean for you.
Yeah, and who would you spend your energy with? So, would you spend time with someone, and why? Why that person? So, yeah, ask yourself those questions, so you can work out what really matters to you and what your long-term health goal is, and yeah, what you would do if you had all this energy. So, if you were better, and if you were better than ever, and you had really high energy, how would that actually change the way you live your life? So yeah, get a diary or get a notebook and write all of that out and see what comes up for you. See what your brain and your body is guiding you towards. It'd be really interesting. And then yeah, let us know, because Emma and I are always really interested in people's stories.
Yeah, absolutely. And get in touch with us by ctm.wise@wales.nhs.uk or on Twitter, which is @WiseCTM. It's not called Twitter now, is it,
No,
Lisa?
X.
What's it called now?
It's called X now. It's called X.
X now. X, formerly known as Twitter.
Yeah.
We are @WiseCTM. And however you get in touch with us, we would love to hear from you.
Yeah.
And now it's time for our question of the week. So we're starting with a frequently asked question this week because nobody's got in touch with us yet. But one of the most common things that people ask us is, if I start using a lifestyle medicine approach, does that mean that I'll lose my space on a waiting list? If I engage in something like a lifestyle medicine coaching program, does that mean that's instead of the kind of the usual pathway of medicine that I'm used to? And it's a concern for people, isn't it, Lisa?
Yeah, this comes up all the time. So people do worry, oh, well, if I'm going to give this a go, does that mean now you're kind of taking my option of medications or surgery or therapy away from me? So we often have to reassure to say, no, if you feel like you need to have that specialist input, of course that's always there. This is something that we can try in the meantime, and a lot of patients do find, oh, actually things have got better. So while I'm on the waiting list and implementing these things are better. But the patient then has to choose to come off that waiting list and decide that they no longer need to be seen, or they can go back to their GP to have that discussion to see if it's appropriate not to see the specialist. But certainly with our service, WISE at the Cwmtaf Morgannwg Health Board, no, you don't get taken off the waiting list to come to our service instead. It'll just stop things from the aim of the service is to stop people getting worse while they're waiting for that, and put in tools that if your specialist needs to do specialist intervention, that actually you'll get a better outcome by using both approaches. And as we said before, it'll help you feel a bit more in control. It'll feel like you're being proactive and you're not just in that waiting zone, that you feel like you're working with your healthcare providers as well. So it can work alongside medications, or any surgery or therapy that you're having. So yeah, you can attend both at the same time.
Yeah, that's great. That's great. So talking of the service, we're just going to tell you a little bit about it now. If you're over 18 and you are lucky enough to live in the beautiful area of Cwmtaf Morgannwg, that's Merthyr, the Rhondda Cynon Taf, or the Bridgend area of South Wales, And if you feel like you want to take control of your health and well-being again, if you've been living with a long-term physical or mental health struggle and you want to learn some tips about how to improve your quality of life with that, then get in touch with us. You can self-refer, so you don't need to wait for a health professional to send a referral in. You can go to our website, Wise CTM, or you can get in touch with us on Twitter at WiseCTM. If you're under 18 and you don't live in CTM, then don't worry, because we'll be sharing wise strategies with you every week in this podcast to help you live the best life that you can. You can also find lots on our website. You can search for CTM Wise, and we've got a blog. We've got lots of videos from patients who've been through this experience themselves. We've got lots of signposting information. There's all sorts on there. So have a dig around and maybe you could get started today.
Yeah, so that's what we were hoping with this podcast, is that not only does it help our patients locally, but actually we can share, the real solutions or the real steps that people have taken who are in very similar situations to you, what's worked for them, and we can share and let you know in order for you to give it a go yourself. So we definitely love to hear from you. So be in touch. Send us your questions and send us your feedback from this week's exercise of imagining yourself better with all that energy and what you're going to be spending it on. But we'd love to hear from you, and we'll be coming back to you with our second episode very shortly. So we look forward to catching up with you then.
Yeah, and if you think it's quite overwhelming to think about why changing your health is important to you and what matters to you and what you want to spend your energy on, then tune in for the next episode of this podcast, because we'll be going through all of that in lots of detail there. Until then, bye for now.
Bye.